OBGYN Exams. The exam. Before the physician begins the examination, the medical assistant should obtain a complete gynecological history. We need to document the patient's history and chief complaint. The medical assistant should prepare the room and the patient for examination. Preparation of the room should occur prior to the patient being brought back to the examination room to minimize anxiety. The gynecological history consists of age of menarche, details about the menstrual cycle, whether it's light or heavy and how long the menstrual cycle lasts, any current indicators of infection, feedback on any breast abnormalities and dates of patient's last mammogram, if they've had a mammogram in the past, date of the last pap smear, which can be looked up by the patient or by the medical assistant. Typically, as a medical assistant, I usually look up the date of their last pap smear before I even bring the patient back. Sexual history and any sexually transmitted infections or diseases that the patient may have had. The number of pregnancies and the number of live births. The date of the last menstrual period. Lifestyle factors including diet, exercise, smoking, and alcohol use are all important in the gynecological history. Assisting in the exam. Show genuine interest in the patient's concerns, support the patient, and assist the physician during the exam. Explain all procedures thoroughly to the patient and what is being done. Breast exam. Assist the patient into the supine position and adjust the gown so that the breast tissue can easily be exposed. Typically, patients should be instructed that the gown should open to the front. Assist the patient if she is having difficulties following instructions to place the arm above the head. Readjust the gown to cover breasts after the examination is complete. The physician may discuss self-examination or may have you explain it at the end of the exam. Abdominal exam. Position the drape to allow the physician to palpate the abdomen. This is done to confirm normal symmetry and detect any masses that may occur. This is oftentimes when we feel for masses for ovarian cancers or ovarian cysts. Place the patient's arm at sides to achieve muscle relaxation. In a case of pregnancy, the fundus is measured to monitor the fetal growth. To measure the fundus, measure from the pubic bone to the top of the uterus, or the top of the fundus. So walk your fingers up alongside the belly. Find the top of the uterus as it feels like a hard ball under the skin, and you can feel the top by curving your fingers into the belly. You would then measure from this point to the pubic bone felt. The pelvic exam remain in the examination room to provide reassurance. Never place the patient in the lithotomy position until the physician is ready to begin. Always keep the patient totally covered and stand at the patient's side. The pelvic exam is generally done after the pap smear. The reason for this is because the lubricant used to do the pelvic exam will coat the cervix and the cells will be hard to obtain for the pap smear. Physician inspects the external genitalia and palpates the perineal body. The vaginal speculum is inserted for examination of the cervix and the vaginal canal and for obtaining the Pap specimen. Have the patient take some deep breaths to help relax the abdominal muscles. Next, the physician inserts 2 gloved fingers into the vaginal canal while palpating the abdomen and the mons pubis. The physician performs a rectovaginal abdominal examination. After the Pap specimen has been obtained, you may be responsible for labeling the specimens and preparing it for transport to the cytology laboratory. If the physician does a rectal examination, oftentimes a hemo-occult card will be needed. It is important for the medical assistant to open the occult card so the physician can swipe the specimen on the card. After the specimen has been swiped, the testing solution will be dropped onto the back of the card and we will look for changes in the coloring. As you can see here, this is how a bimanual pelvic exam is done. 2 fingers are inserted into the vaginal canal, as shown here, and oftentimes one is into the rectum and the other is into the vagina. Post-exam duties: help the patient into a sitting position. Monitor the patient for any dizziness or lightheadedness that can occur after sitting up from lying down. Remove examination equipment and supplies, and oftentimes I offer patients tissue to clean themselves up before leaving the office. The room should be cleaned and restocked after the patient has left. Prenatal visits include an overall assessment of the woman's health status, including vital signs, weight, and urinalysis. Prepare the patient and also supplies and equipment necessary for obtaining pelvic measurements. Perform serological tests and prepare for laboratory tests. Collect a urine specimen for urinalysis. Weigh the patient, measure the blood pressure, and answer questions about diet and health habits. Once recorded, fetal heart rate is assessed at each subsequent visit. Healthy overall weight gain for mom is about 25 to 35 pounds. Data collected. At the first visit, we will ask what the first day of the last menstrual period was. The expected date of conception is then calculated using the wheel. The expected date of delivery is calculated using the wheel and then confirmed with a sonogram. The weeks of gestation can be calculated based off of these numbers. As you can see here, this is a pregnancy wheel. The first date of the last period, you will line up what date they have given you. So here, this person's last date, the first day of their last period was February 20. No, it was March 4th. Probable ovulation was March 19th. And the probable implantation was March 25th. So the expected date of delivery would be December 10th, as you can see here. These numbers throughout the wheel are the weeks of gestation. So we can determine how far along they are, and also it shows with the colors which trimester they are in. We will write this down and document this in the patient's medical record. The sonogram is a high-frequency sound waves that are used to produce images of the body's soft tissues. Skin over the area to be studied is coated with a conductive gel or lotion. The grayscale images form pictures of organs and blood vessels. The Doppler method converts the ultrasound into audible sounds that are heard as pulsations. We often use the sonogram to confirm the estimated data delivery, and we also use it to assess any congenital deformities that may be there. The fetal Doppler heart rate is used to get the heart rate of the fetus. This is oftentimes done every time there is a checkup in the office. Some prenatal testing that we may do at some of the beginning appointments are a hematocrit and hemoglobin level to check for anemia, the blood type and RH with antibody screening for possible RH incompatibility, a rubella titer to determine whether the mother is immune to German measles, which can kill the fetus if the mother contracts this disease, syphilis screening, hepatitis B screening, HIV screening is suggested and in some states not required. A pap smear if one has not recently been done, gonorrhea and chlamydia cultures, urinalysis to detect protein, white blood cells, and glucose, Group B streptococcus culture of the lower vagina, non-stress test to evaluate fetal heart rate, and stress test or oxytocin challenge test if the non-stress test is abnormal. What is a non-stress test? A small amount of oxytocin causes the uterus to contract and is administered intravenously. The mother is attached to a fetal monitor to see if the fetus will respond to the normal stresses of labor. If the fetus does not respond to the minimal contractions, this is a good thing. If the fetus overly responds to the stresses of labor in an abnormal way, this is considered an abnormal test, and further testing will need to be done to prepare for later gestational weeks and for the birth of the child.